Good morning, everybody. I am so happy to see all of you here today on Good Friday. I was really thinking that there wouldn't be a big crowd, so I'm a little nervous now that I see all these people. So thank you all so much. So my name is Clara. I am President and CEO for the Crisis Center of Tampa Bay. I've been there close to 9 years. I am from Tampa, born and raised, so it is truly an honor to be here at this amazing event today. When I came to the Crisis Center of Tampa Bay, for me, it was really a phenomenal professional opportunity. I am a licensed clinical social worker by trade, and I had spent my entire career in the deep end of the social work field. I started as a child protective investigator for the Department of Children and Families in Leon County, came back home and worked as a school social worker with Hillsborough County Public Schools at Kenley Elementary, and then I moved to youth services. So I was covering all of the juvenile justice facilities, and this was in the 90s when the juvenile justice system first started. So we were taking kids as young as 7 and placing them in very restrictive settings at Falkenberg Road even. And one of the things I learned working with that population is that trauma untreated does not go away. It continues to exacerbate itself throughout the life cycle. So being able to come to the Crisis Center is so important because our mission is to ensure that no one has to face crisis alone. We utilize 4 pillars to measure the work that we do, and the biggest one for me personally is connecting the gateway. If people don't know that we're here and available in the community, then when they're in crisis, they don't really know where to go. So you will see on your table these fabulous little plastic cards that says 211. 211 truly is the entryway to get to help and support. This is a national number. So it doesn't matter if you're in Pensacola, if you're in Pennsylvania, if you're in Portland, it doesn't matter. You can call 211 and be connected to local resources that will help you get through whatever you're going through. Now, the word crisis oftentimes will make people a little nervous, or they're like, oh, no, I'm not touching that with a 10-foot pole. I just want to define crisis for you as we have this conversation today. A crisis means that somebody is going through a life's problem, and they just need help finding the solution. What's a crisis for me may not be for Nikki, may not be for Ken, so it's very individualized. One of the things that we do every single day is to allow people the opportunity to talk about what's going on in their lives. I say that the Crisis Center is different than Google, right? Because you could Google anything that you're looking for. Oftentimes, what we find is that when people are in crisis, it is the symptom of the day that brings them to us. And it's oftentimes a basic need. Food, clothing, shelter, those are the easy ones. You have an elderly parent who is no longer safe in their home and you don't know where to go or where to turn. You've got a child that is struggling in school. Maybe you have a small child that is regressing in their developmental milestones. You typically will call us for this symptom. But oftentimes it is that conversation. It is giving you the opportunity to vent everything that's in your head, everything that's in your heart, so that as we're listening, we can help to develop solutions with you to the underlying problem. And that, honestly, is what makes us very different than Google. So not only are we run 7 phone lines all around crisis. We run 211-988, which is the crisis and suicide hotline. We have a hotline for veterans in crisis, answered by veterans, which is really the secret sauce. Because nobody wants to talk to me. I'm a licensed clinician, but I've never served. Nikki and I were just sharing a conversation with her nephew who just got out of the military. Military experience looks very different, and a military member in trauma looks very different. Having that peer-to-peer makes a lot of sense. We also created a line for first responders. More first responders die by suicide than in the line of duty. We know that. Many of them suffer in silence alone. We created a line that, thanks to the Florida legislature, we will be able to take statewide with the governor's signature. So that's really exciting for us. We have a line for teens and young adults who are struggling. We answer the substance abuse hotline, the rape crisis hotline, all of these different hotlines touching over 105,000 people a year who are in some sort of crisis right here in our community. Those are your family members. Those are your friends. Those are your colleagues. Many of you sitting here right now may be silently suffering or dealing with your own crisis. And because it's internal, nobody knows what's going on. You don't have to face that alone. We also run 2 certified rape crisis centers in Hillsborough County. We're very lucky. If an individual is sexually assaulted in Hillsborough County, they don't have to sit in a hospital ER. And if any of you have been in an ER recently, it can take up to 24 to 36 hours to be seen right now in our ERs because it's so very busy. If you've just been sexually assaulted, that's the last thing you want to do. So we were able to provide that level of service both here in North Tampa as well as in Ruskin. We provide trauma counseling, medical transportation, both for somebody with a physical issue as well as somebody suffering with a psychiatric or substance use issue. And we have a wonderful partnership with Tampa International Airport around helping travelers in crisis. You would be surprised the number of people who come to us, over 40,000 a year, who are struggling with some sort of crisis at the airport. All total, we touch about 170,000 people. So that brings me very quickly to the topic I really wanted to focus on today, and that's around crisis. You look at what is happening post-pandemic. I think we're technically this month, we're 4 years since the start of the pandemic. And for us at the Crisis Center, when the pandemic hit, people were calling us in February, early February, hearing about this thing and they were worried about their health. Starting this time 4 years ago, people were calling us because they were economically terrified. They were already losing their jobs. They were already worried about making their rent payments and being able to put food on the table. They didn't know what they were going to do with their children. And that continued for about 3 months. And in June of 2020, we really saw the tide change. Folks were calling concerned about their economics. They were concerned about their mental health. And I remember one phone call that we took probably in August, September of 2020 from a gentleman who said to us, "Oh, I get it. I never believed in mental health. I just figured these people were weak. They needed to suck it up, buttercup. But now I'm the one that can't get out of bed because I'm so terrified of the virus. I'm terrified about what's happening in the world. I'm scared of the weather. I am scared of everything." And that's what we have seen since the pandemic, is more and more people recognizing that they're struggling and that they need help and support. The next piece of that, though, is where do you go for help? Obviously, we've got the Crisis Center that's available, but there are many other organizations. The one thing that the Crisis Center does is that we basically maintain the database of services for Hillsborough County. And that requires just a lot of support because there's over 4 organizations that are providing assistance and support. Making sure that information is up to date is really important. And that is one of the reasons why we don't produce a flyer or a guide. Because the moment you print that sucker, it's out of date. Because we're in a great community and there are a lot of great resources that come and there are a lot of great resources that unfortunately leave. So we try to maintain all of that information. So when you're in a crisis, how do you find that service and support? What we hear is that many people utilize friends, family members, wonderful faith institutions, things like that. But there are also, many of them are utilizing other forms. They're utilizing the internet, they're utilizing social media. All of these areas can be very positive, but they can also have some negatives, as you can imagine. So we deal with all of that, when the resource works and when the resource doesn't quite work. One of the other things that people ask us is that, is there a way to prevent crisis from happening? Well, sometimes there is. We think about where we are right now. We're almost to April. We all know that we're essentially 2 months away from hurricane season. Hurricane season brings a lot of crises to individuals here in Hillsborough County. You all know we've had a lot of near misses of significant storms. So there are a lot of individuals that start to get a little bit more anxious. this time of year as the hurricane season approaches. We really try to encourage individuals when they call us and they're anxious and they're worried, is to start making your plans now. One of the ways to combat crisis situations is to be as prepared as possible. When we have seen mass shootings, and Bill, you mentioned that, the shooting that happened in Ybor in October, when we've seen mass shootings, many individuals will call us very concerned. Well, what do I do? Should I stop going to the movies? Should I stop going to bars? Should I stop engaging in the world? And what we encourage them is that, no, don't stop engaging in the world, but make sure that you have a plan. Make sure that when you're in the movie theater, you know what's going on around you. You know where the exits are. Make those plans. For those parents who call us after school shootings, terrified to send their 5-year-old back to kindergarten, how do we help them through that? We help them through that by helping them create plans with their children. So many people, their crisis is that they don't know how to explain this information to their kids. We help them do that. We tell them, number one, ask your kid, what do they know? And then correct any misinformation. We may believe that we are keeping children safe through, maybe they don't have a phone or you don't listen to the news, but I promise you, their friends, the other children in school, they are sharing information that may not be correct. So we encourage parents, correct misinformation. Then the third thing we ask is ask your kid how they're feeling. More likely than not, they'll be, I don't know, I'm fine. And that's really the fourth step, is talking about your feelings. Teaching your kid how to have those discussions. Teaching your child what is the language that they can use to talk about their crisis and what they're going through. Because one of the things we have learned at the Crisis Center is using your voice, talking about your feelings, is the most important way of being able to manage your feelings, your emotions, and helping you move through a crisis. So with that, I will open it up to questions, and thank you guys so much for allowing me to be here this morning.